There is notable overlap between the tender points used to diagnose fibromyalgia, FM, and the enthesitis locations seen in spondyloarthritis, SpA. Enthesitis is a hallmark feature of SpA, characterized by inflammation at the sites where tendons or ligaments insert into the bone, whereas fibromyalgia is a chronic pain syndrome with tenderness at specific soft tissue locations. This overlap can lead to diagnostic confusion, as patients with SpA may report widespread pain and tenderness similar to those with fibromyalgia. Key points of overlap. Both fibromyalgia and spondyloarthritis share pain in certain anatomical regions, particularly those involving muscle insertions and ligament attachments, where tenderness or pain is commonly reported. Comparison of overlapping sites. 1. Occiput versus enthesitis in SpA. Fibromyalgia tender point, located at the suboccipital muscle insertion just below the base of the skull. SpA enthesitis. Enthesitis can occur at the cervical spine or the ligament insertions in the posterior neck, leading to neck pain and stiffness. 2. Low cervical region, fibromyalgia versus cervical enthesitis. Fibromyalgia tender point, along the anterior aspects of the intertransverse spaces of the C5-C7 vertebrae. Cervical spine enthesitis affects ligaments and tendons attached to the cervical vertebrae, causing pain and stiffness in this region. 3. Trapezius, fibromyalgia versus enthesitis at the shoulder, ESP, fibromyalgia tender point, the midpoint of the upper trapezius muscle. SpA enthesitis. Inflammation can occur at the entheses of the shoulder where the tendons of the rotator cuff attach, leading to pain similar to fibromyalgia tenderness in this area. 4. Supraspinatus, fibromyalgia versus shoulder enthesitis. Fibromyalgia tender point, above the scapula at the origin of the supraspinatus muscle. SpA enthesitis, enthesitis at the rotator cuff or shoulder attachment sites, particularly around the scapula, mirrors the pain in fibromyalgia's supraspinatus tender point. 5. Greater trochanter versus enthesitis at the hip, fibromyalgia tender point, posterior to the greater trochanter, prominent bony part of the hip. SpA enthesitis, common in the hips, particularly at the greater trochanter, where gluteal muscles attach, leading to similar tenderness and pain to fibromyalgia's hip tender point. 6. Lateral epicondyle, fibromyalgia versus enthesitis at the elbow, SpA. Fibromyalgia tender point, 2 centimeters distal to the lateral epicondyle on the outer side of the elbow. SpA enthesitis, enthesitis at the common extensor tendon insertion at the lateral epicondyle, known as tennis elbow, mimics the elbow pain seen in fibromyalgia. 7. Gluteal fibromyalgia versus enthesitis at the ischial tuberosity. Fibromyalgia tender point, in the upper outer quadrant of the buttocks. SpA enthesitis at the ischial tuberosity, which is the bony prominence where the hamstring muscles attach in the pelvis, often causes deep buttock pain similar to the fibromyalgia tender point. 8. Knee fibromyalgia versus enthesitis at the patella, SpA. Fibromyalgia tender point, the medial fat pad just above the joint line on the inner side of the knee. SpA enthesitis. Enthesitis frequently occurs at the patellar tendon and other ligamentous attachments around the knee, which can result in pain and tenderness overlapping with fibromyalgia's knee tender point. 9. Second costochondral junction, fibromyalgia versus enthesitis at the ribs. Fibromyalgia tender point, at the second rib where the rib meets the sternum. SpA enthesitis. Inflammation can occur at the costochondral junctions or sternoclavicular joints, leading to chest wall pain that overlaps with fibromyalgia's rib tender point. Distinguishing between fibromyalgia and enthesitis in SpA. While these regions overlap, the underlying mechanisms of pain and their associated features differ between fibromyalgia and SpA. Fibromyalgia, widespread pain. The pain is generalized and not necessarily related to inflammation. Tender points. Fibromyalgia pain is more related to heightened sensitivity in soft tissues and is assessed via tender points, which are typically non-inflammatory. Non-inflammatory. Fibromyalgia is a centralized pain syndrome with no inflammatory markers, e.g. elevated CRP or ESR. Spondyloarthritis, SpA, localized pain with swelling. Enthesitis in SpA is localized to the insertion of tendons, ligaments, and fascia into the bone, often accompanied by inflammation, swelling, or warmth. Inflammatory nature. Enthesitis in SpA is associated with local inflammation, which can be confirmed by imaging, e.g., MRI showing bone edema, or by elevated inflammatory markers, CRP-SR. Response to NSAIDs. Enthesitis-related pain in SpA often improves with nonsteroidal anti-inflammatory drugs, ENDS, whereas fibromyalgia pain typically does not. Clinical considerations. The overlap between fibromyalgia tender points and SpA enthesitis can create diagnostic challenges. Misdiagnosis is possible if the focus is solely on pain and tenderness without evaluating other signs of inflammation in SpA or central sensitization in fibromyalgia. Key distinctions are fibromyalgia. Symptoms such as fatigue, cognitive dysfunction, fibrofog, and unrefreshing sleep are key to diagnosis. SpA. Key features include morning stiffness, axial involvement, e.g., sacroiliitis, dactylitis, and a positive response to NSAIDs. A thorough clinical evaluation, including the use of imaging and lab tests, e.g., MRI for enthesitis or inflammatory markers, is crucial for differentiating the two conditions.